This is Parin Parmar from Rajkot, Gujarat. And first of all, I would like to congratulate organizers of this conference for planning and conceptualizing this conference, combination of yoga therapy and music therapy, two very important non-pharmacological systems which are very important for health and well-being of patients as well as for normal healthy persons. And I also thank the organizers for inviting me for this topic. I would like to talk about music therapy in pregnancy, and I'd like to mention that my interest in this particular topic arose when I had an interesting case back in 2014. She was a 28-year-old woman. She was a pulmonologist from Mumbai, and she was advised music therapy during pregnancy. And as she was in Mumbai and I was in Rajkot, so I had planned some combination of passive and active techniques, but more of passive techniques, listening to music during pregnancy. And everything went on well. And 3 months after her delivery, she called me once and asked, Doctor, since his birth, she had a male child. So since his birth, whenever my baby cries, I play the music which I used to listen during pregnancy, and he stops crying. And his behavior changes as if he remembers the music. So thing is that he does not stop crying when I play any other music. So is it possible that the baby remembers music which was exposed to him during the fetal life? So theoretically, the answer was yes, as a music therapist, but this was my first personal experience which sparked an interest and curiosity in this area. And then similar experiences continued to follow with other patients as well. So apart from beneficial effects of music therapy, which are known for pregnant mothers, as a pediatrician, I was more than happy with this particular effect. So we know that crying infant is a very common OPD presentation for pediatricians. And unless there is an organic cause for crying, a pediatrician does not have specific remedies to offer for crying infants. And there are some common causes of crying like colic, hunger, food sensitivities, painful medical conditions. But there are some non-organic causes like boredom, fatigue, and excessive stimulation, which are the causes of crying in an infant. And again, as a pediatrician, I have not too much to offer to them. So now I was happy to find one more indication for music therapy during pregnancy. And I thought that, okay, so the planning for a remedy for a crying infant could start from pregnancy itself. So this was an interesting case for me. So now coming to the topic, as such, music therapy in pregnancy is a very broad topic. So it includes antenatal music therapy during pregnancy, antenatal music therapy during medical procedures which are carried out during pregnancy, antenatal music therapy during hospitalization in case of pregnant woman requires hospitalization, antenatal music therapy during delivery. It could be normal delivery or instrumental delivery or cesarean section, and music therapy in postnatal period. So after delivery or during post-operative period. But in this presentation, I would like to focus only on music therapy in antenatal period in normal pregnancy for normal pregnant women. So we all know that pregnancy is a period of physical, emotional, and hormonal changes for a woman. And stress, anxiety, and depression are very common during pregnancy. In fact, more than sometimes we assume. So studies show that 84% of pregnant women experience stress and 6% of them experience high level of stress. And 20 to 25% of women experience anxiety during pregnancy. And the incidence of anxiety increases with progression of pregnancy. So it is highest in the third trimester. And 5 to 16% of pregnant women experience depression. So even if we do not talk about the specific indications of music therapy in pregnancy for obstetric reasons, still music therapy is indicated to reduce stress, anxiety, and depression for pregnant women. But stress itself is associated with so many medical conditions and obstetric conditions. There are so many medical disorders which are known to be aggravated by stress, like hypertension, diabetes, autoimmune conditions, allergic conditions. And there are some obstetric conditions like preeclampsia and abortion are associated with increased antenatal stress, and so as preterm delivery and therefore birth of low birth weight infants. So not only stress during pregnancy affects the mother adversely, but studies show that antenatal stress is associated with complications in the future newborn, like increased emotional problems during childhood, impaired cognitive development, increased symptoms of attention deficit hyperactivity disorders, ADHD symptoms, increased risk of schizophrenia. And even some studies have shown that severe stress during first trimester of pregnancy is associated with increased risk of congenital malformations in the newborn. And stress during later pregnancy is associated with negative effects of motor development in the infant. And we already know the complications of premature birth, prematurity, and low birth weight in neonates. So it is a very long list. It could be a list which could require a short note. So we all know that prematurity and low birth weight themselves, they cause so many complications. And antenatal stress is associated with prematurity and low birth weight as well. So stress reduction during pregnancy is very important, both for mother as well as for the infant. And music therapy, when used in pregnancy, these are the common techniques, although so many other techniques can also be used. But if we go through the literature, scientific literature, the most studied technique is listening to music, which is the passive technique. And usually most of the studies have involved patient preferred music for listening. But music therapists frequently use progressive muscular relaxation with music, recreational music therapy, group music therapy, music assisted exercise during pregnancy. And mothers can be singing lullaby directed towards fetus. So also fathers. So these are the also techniques which are used during pregnancy. So let us go through the beneficial effects of music therapy for mothers. And they are reduced blood pressure, reduced muscle tensions, reduced backaches, improved physical relaxation, improved sleep quality, improved physical activity. Of course, this all translates into reduced medication requirements, and that's how reduced side effects of the medications. So as psychological effects like decreased anxiety, decreased psychological stress, improved mood and well-being, improved family relationships. And music therapy also helps to mother to identify her role as mother for the future family. So these are all the benefits for mother. And regarding neonatal effects, the positive effects of music therapy during pregnancy, I'm not talking about neonatal music therapy. I'm talking about antenatal music therapy, which has shown to produce beneficial effects on the future neonate. And studies have shown that fetus who have exposed to music therapy during pregnancy, they exhibit improved neonatal behavior, especially in domains of orientation and habituation. They experience reduced stress during the neonatal period, and those neonates they find it easy to adjust with the family in the new environment in first months of their lives. So these are already what different studies have shown regarding effects of antenatal music therapy in future neonates. Now, I'd like to mention here that while a fetus is developing inside the womb, structure parts of the auditory system are well formed by 15 weeks of gestation, and auditory system becomes functional between 25 to 29 weeks of gestation. And a uterus, when in uterus, fetus is exposed to so many sounds like voice of mother, mother's heartbeat, other abdominal and thoracic sounds from the mother, and environmental sounds. So the fetus is already exposed to some sounds, some music, some noise while inside the uterus, and the fetus is able to perceive them when the auditory system becomes functional. And when the fetus is constantly exposed to low frequency maternal heartbeat, it provides an important rhythmic experience for the fetus, and they exhibit the response to external sounds by either showing changes in heart rate or by showing motor responses like flickers or movements of limbs or head. And because they are covered in the amniotic fluid and so many tissues, so usually it is high frequency sounds which affect them more from the environment. So coming to the case from which I started the presentation, there is already one randomized control trial conducted in second decade of this century, which suggests that memory of music which was exposed during pregnancy persists at least up to 4 months of age after birth. So it was in this trial, it was the fetus was exposed to a melody, particular melody during the fetal life, and after birth, the fetus were never exposed to the same melody, and then they were exposed to altered melody. So the researchers had made some alterations in the melody, and after, with use of EEG, electroencephalogram, it was identified that the neonates were able to identify the changes or alterations in the melody which were made by the researchers. So whenever a wrong note was played, their brain would react even during neonatal life up to 4 months of age. So no data after this age. So it was not that after 4 months of age the effect was lost, but it was the study was conducted up to 4 months age of infants only. And there are other studies which have shown that neonates who were exposed to music after 5th month of pregnancy, they exhibit alerting response or calming response in response to the same music. So other studies also suggest that neonates have memory of the music which was heard during pregnancy. So we know that neuroplasticity is a known effect of music therapy in children as well as adults, and it facilitates neural development. It facilitates connection between different areas of the brain. So neural development and fetal learning are interrelated, and as music therapy provides a positive auditory experience, it should facilitate early brain maturation of fetuses. So there is a lot of scope for research, and interesting revelations and discoveries are to be made in the area of fetal memory and fetal learning. But if it is discovered that fetus can be trained or fetus can be taught something while in womb, it reminds me a story of Mahabharata in which Abhimanyu, the son of Arjuna, was exposed to the way of breaking Chakravyuh by Lord Krishna while he was in womb of his mother Subhadra, and the rest story I think everyone knows in India. So there's an interesting field of research, I would say, and much more discoveries to be made in future. But now, if we talk about beneficial effects of music therapy during pregnancy, I would like to also mention that if music affects positively, then noise definitely should be damaging nervous system and auditory system of the fetus, which is also shown by studies. So it has been shown that 60 to 80 decibel of noise can damage developing fetal auditory system. So this has importance in today's time when so many pregnant mothers, even during second and third trimesters of pregnancy, they continue to walk, which has too much noise in the environment. So they should take cautions. And there are multiple mechanisms by how noise can adversely affect developing fetus. It can directly affect the developing auditory system of the fetus, as well as it has indirect effects as it produces stress in mother, and so mother cortisol level increases, and developing fetal brain has cortisol receptors. So increased exposure to cortisol during fetal life also has adverse effects on developing brain of the fetus. So this is how noise exposure should be avoided during pregnancy. So with this, I would like to end my presentation here. Thank you very much again for making me part of this conference, which I am sure that it's a wonderful conference as it has always been. And I thank the organizers again, and all the best to everyone. Thank you so much. Bye.
Thank you so much, Dr. Parin, for that beautiful presentation, which is our last presentation for the day. We now go into the panel discussion, which will be a shortened version today. We didn't want to miss a single presentation, so we have made sure all our presenters, their thoughts were shared with you, and all of this is on the YouTube channel also. There will be one edited version because Cheryl had asked us not to publicly share her presentation, but because all the talks were going live on YouTube, we couldn't stop it at that point. So that one will be unlisted for now. We'll edit it. Her part will be edited out and then it will be made available. Because when a presenter makes that request, it is our dharma to follow it. But we didn't want to stop in the middle at that point and do it. So I would like to request our Professor Madanmohan sir to please come to the dais. Professor, our Dr. Uttareshwar ji to please come. Subbu Bhaiya, are you there? Yes, please. We have Subbu Bhaiya here. Dr. Rama Reddy sir, he is to be here. I'd like to also request Dr. Sobana ma'am to be with us on the panel. She has been multitasking today. She is a Deputy Director of the Medical Simulation Center, and so having to run their event plus our event here, so it's a double duty. Also requesting Yogathilakam Cathy Davis, Yogacharini Devasena Bhavanani, Dr. Baishali Mukherjee, Dr. Satish Pathak to be with us for this panel. Actually, Cathy, I suggest you put it here for Cathy, because the camera captures this angle better. Yeah, because Miss Varika, yeah, otherwise it doesn't. No, that's, I think we need one more. Yes, one, you can bring that in. Inge one kondu varanumpa. Pathak sir. Yes, yes. Ingo chair. Nilachal, one chair here. Because then, yeah. This is perfect. Because then the camera will come. It's okay. Yeah. Fine. Yeah, I don't know. Yama, na there na avasil na. Okay. So we don't have too much time, so I'm now going to go into too much of detail of introduction. We have introduced everybody here. You have met them over the last 2 days. And so I think we will go straight into the person who hasn't yet had a chance to talk, and that is our Dr. Uttareshwar ji. The question to you is that you are representing Sri Aurobindo Society. Pondicherry is known worldwide as the city of the dawn. We know that Sri Aurobindo and the Sri Mother have given us the beautiful message of spiritual Pondicherry. Can you share how that spirituality of the Aurobindo tradition is enabling wellness to manifest for all?
I can sit while talking, yeah? That should be more comfortable. See, Sri Aurobindo and Mother's yoga is popular with the label as integral yoga. And this integral yoga means not integration of all yogas or practices. The integral yoga means the yoga practices where all the planes of our being, they are integrated together. And this concept of the real personality or the core of the being is learned well after teaching of Mother and Sri Aurobindo. See, in homeopathy, what we practice, we always used to say that it is the vital force which governs body and mind. But then after coming in contact with teachings of Sri Aurobindo and Mother, we had to make changes of the interpretation, and to our surprise, the philosophy which was translated 200 years back, because original philosophy is written in German, and that was translated by one Dr. Dejean before 200 years, and all over the world it was understood that it is body and mind which is governed by vital. But then now, after learning Sri Aurobindo's teachings, when we started actually reviewing the understanding, and then we called one English professor who was conversant with the English which was prevalent before 200 years, and then he told, no, actually the interpretation is this, that it is the vital which animates body, vital which animates the body, and that instrument, the animated body, is utilized by reason gifted mind for higher purpose of life, that is spiritual development. So all these planes, actually Sri Aurobindo was the first one among philosophers to come to this plane, and now he has talked elaborately about all these planes. All these koshas, Annamaya kosha, Namaya kosha, Jnanamaya kosha, all these koshas together, and Mother has written elaborately about illnesses also. Sri Aurobindo and Mother, we always have a concept of illness, that illnesses all come in dynamic form. The virus or the bacteria, they are all what we call vectors, or sometimes we call them saprophytes, because the tissue is first affected and then bacteria gets susceptible and then bacteria thrive on it. So we call it saprophytes in extreme term. Not only that, this dynamic concept of disease and illness was practiced, because see, everyone has heard about First World War and Second World War, and these two world wars, one person was instrumental in this. It is humanly absolutely not possible. So Mother and Sri Aurobindo had a conviction that there is some negative satanic force which is possessing this individual for implementing what we call anti-divine activity, and they were working on that line. Even our theosophical movement used to work on that line. So this is how, and even Sri Aurobindo and Mother have said that medicine can't be in material form. It has to address the deeper core of the being. And therefore, even in homeopathy, we started practicing, like initially when we were practicing such a minute dose, few people used to respond, few people were not responding. And then when we realized or went into details, we say when there is maintaining cause or some obstacle to the cure, then the cure cannot take place. And there the role of yoga came. And where all yoga practices, when we started, and healthy lifestyle again with that. And once the person is asked to follow the yogic practice, healthy lifestyle, and then we added homeopathy, in just few doses person started responding. That is what I always call yoga therapy has to be the primary therapy. Primary in the sense 50% job is done by lifestyle and yoga, and 50% job is done by stimulation with the medicine. But the first 50%, essential 50% is yoga, and second 50% is done by other systems. I won't call homeopathy alone, but it can be any system. So this is how it helped us to learn homeopathy also better.
Thank you so much, sir, for that beautiful explanation. I think that takes us straight to Rama Reddy, sir, because being one of the top psychiatrists of India, what is the role of mind-body when it comes to wellness and disease?
WHO, sir, WHO says about the body health, mental health, social health, and of course the spiritual health also is being contemplated. So here the mind plays the pivotal role because it is the central point between, it is the translator of the body feelings to the society, and the societal issues to the body, and the spiritual issues become the inner layer of the mind. So the mind is the central point, we can say. Here, according to the yoga, we have got the ancient teachings like the Nara concept of Gitananda tradition, like Adi Vyadi concept, and in the modern aspects also we have got the psychosomatic medicine or psychophysiological medicine, which has been thriving for the past 1 century. They have realized that although we treat peptic ulcers, bronchial asthmas with modern medicines, there must be some psychological factors which are affecting them in the form of some stress also. See, for example, bronchial asthma, if we take up, it is something like a cry. The inside sadness, which cannot be expressed so freely, is expressed through asthmatic attacks. Similarly, we people say that my heart is burning or my stomach is burning because he has insulted me. In Telugu we say kadupu mandipoyindi. Maybe white burnt or so, something of that sort. Okay, so that means literally also when we are with anger, we get hyperacidity, and ultimately leads to peptic ulcers. And it is a blow on my heart. So it is something like a heart attack. Myocardial infarctions, the cardiovascular issues are connected with psychological factors. Even the psoriasis which we do not have any proper treatment at all, is psychologically determined. Even many arthritis cases, even low back pains. So many things are associated with mind. So similarly here, when we, not only the illness part, but wellness part also, mind plays a good role. So here, when I talk about the psychosomatic illnesses, we should talk about the functional category also. Usually, any person who goes with some symptom to a physician, if it fits into his model, his textbook model, it is particular disease. Yeah, this is seizure disorder, he says. If it doesn't fit into any classical description of seizure disorder, it must be functional. Functional means it is not really functional, but it is functional for the patient to enjoy that one. Sickness enjoying thing. Unconsciously he is enjoying the thing. The so-called, the previous name hysteria. Nowadays we call it as dissociation and conversion. So a girl goes with chest pain to a general physician, she goes. He could not do anything. goes to cardiologist, some 50,000 rupees or 1 lakh rupees investigations. Nothing is found, but he prescribes something, but she doesn't get any relief. Ultimately, it comes to the level that because her heart was stolen by somebody and hurt by somebody, she is getting the heart pain. So it is symbolic there, psychologically a symbol of a symptom like. So it is not here psychosomatic, but it is something called hysterical thing. So these are all, mind has got the role. And if you go to a general hospital where so many people would be complaining so many things and the register will be maintained there, the name, age, native place and the diagnosis part. Yeah. If you observe the diagnosis, they write fever, headache, leg pain. And if somebody asks, is leg pain a diagnosis, sir? Is headache a diagnosis? You are writing whatever the patient has complained, you are writing there. Oh, I think we have to be a bit careful. Instead of writing fever, let me write pyrexia. Instead of headache, let me write cephalalgia. So it would be a nice thing to write there. 40% of the people who attend general medical OPs, they have got some psychological basis of some other thing. And just for their relief or their tension relief, they will be going to a place like hospital. They will be just connecting to the doctor as an authoritarian so that they will get some relief by going there. So these are all the psychological things we should take care of, not by prescribing some anxiolytic benzodiazepine or some antipsychotic drug, just simply because we have got the pharmacotherapy with us. So it is not the right thing. As you know, we have got the 5 stages of health maintaining. The prevention and the health promotion is the first thing, the prevention is the second thing, early diagnosis and treatment is the third thing, and of course, I mean, the incapacity limitation is the fourth one, and the rehabilitation is the fifth one. So the first 2 things we usually do not care at all, because those things are not quantified or not included in the general medical things. Here the mind plays a proper role. So prevention and promotion aspects, because the mind plays a role, salutogenesis is a good concept or the best concept or the only concept. We can say that instead of going for the pathogenesis and controlling that one, salutogenesis, where interventions like yoga, where they work through mind, would be the ideal thing. And in the modern medicine, we go to the extent of annamaya kosha and mostly to the pranamaya kosha. And psychiatrist has the privilege to go to the manomaya kosha also. But all together and integration, I think we can do through yoga only, sir.
Thank you so much, sir. I like that psychiatrist has a privilege to go to the manomaya kosha. That's a classic statement from Rama Reddy, sir. Such a beautiful statement. Speaking of the mind, and you talk about the heart being stolen, Subbu Bhaiya, maybe something about how Bhakti Yoga can bring this about.
Namaste. So, Bhakti is all about dealing with our bhavanas. In fact, yesterday with Sridharan sir and many presentations from the KYM, we could hear this term again and again. Unlike in other schools, we would be hearing only about asana, pranayama, mudras, bandhas being presented in the yoga protocol, whereas they were presenting about bhavanas also, which is nothing but our emotions. So as our Guruji, Dr. Nagendraji puts it, it is about emotions culture. We are all always bound by our emotions, both positive and negative. The real Mahabharata which happens in our mind, between these Kauravas that we have, in fact more in number, and less the Pandavas, the positive emotions, a tug of war which happens between these often. And in this, the culturing of the emotions, which means all these bhavanas, all the emotions than to suppress, to sublimate. That's all about bhakti. So it is transcending the emotions It's about elevating them, sublimating them by channelizing these towards the divinity which is not elsewhere, which is very much again within us. So to look within the divinity which is inborn, right? So that is the main aspect of bhakti. And as Doctor was talking about the koshas, so bhakti is one of the wonderful tool for channelizing the manomaya kosha. So to reach there, the manomaya kosha, that's one of the easiest and best tool to go there, because emotions are something which is quite common. You know, if we try to classify the people, the tool of Jnana Yoga is for quite a few who are very analytical, who are brain oriented, who has a capacity to question. Whereas to feel is quite common with everyone. Emotion that is quite common in all of us. So taking that and then understanding that through probably the tools of the Navavida Bhakti, even what we hear is itself the first way to get into the area of bhakti. The thinking capacity, instead of thinking of the negativities, to think of the positive qualities is what Smaranam is. And then we all have this habit of talking, telling, complaining and all those. So that is what as Kirtanam which brings in, you know, even the tool of complaining what we have, Bhaktas have used it as a Ninda Stuti of complaining to the God. You know? So putting our difficulties as a prayer to Him. So even Prarthana, what we say is a very important tool of Bhakti, the Kirtana, Prarthana. Is when we channelize all our emotions in the form of a prayer, talking and then sending it to the divine. Again, as we understand, which is not elsewhere sitting up above the world so high, but which is very much within. So, and then Bhakti when translated into action, in fact the very word Bhakti comes from the root of Bhaja Sevaya. So it is Seva in action. So Bhakti in action is Seva. So to become selfless is the more important thing. All these problems in the Manomaya Kosha is happening because of, as Dr. G and Ammaji says, the me in me. I have a friend in Bangalore, a Swamiji friend, who used to say the me in the me in you, the me everywhere. So the me is what it all creates. It's all about, so from me to we. So bhakti is from the feeling that we have to translate it to action through the seva that we have. So the joy of sharing and carrying comes there, which of course Swami Vivekananda puts it as the karma yoga, but they're not separate. It all goes in hand. This bhakti is one thing which we see common in all streams of yoga. The Ishvara Pranidhana aspect in the Ashtanga Yoga, Raja Yoga. The surrender, the Sharanagati in Bhakti Yoga ultimately. So if you understand, it's not about people sometimes say surrender is because of our limitation. It is not about the limitation, that surrender is actually expansion, as Swamiji said. Swami Vivekananda said. So if you understand this and then expand these emotions to the universal well-being, then that is bhakti really into action. So through which all the problems, we say manayeva manushyanam karanam bandha mokshayoh. Mind is the culprit which creates all the problem. And using mind itself, karanam, bandha and moksha. So using mind, the manomaya kosha, culturing it, nurturing it and elevating it through the emotions of bhakti, which is easy through what Devasena ma'am was presenting, the beautiful aspect of the dance, of music therapy which is going on here. And I was in fact thinking that these two are not separate. The two parallel tracks should not be there. It is only one and the same. Music is, if you have to put an action, somebody was asking me, what is a practice that you would prescribe for Bhakti Yoga? We have asana, pranayama, dhyana for the Ashtanga Yoga, for the Raja Yoga. So what is the practice that you would say? It's music. It is dance. And they are yoga. If you understand the definition of yoga very well, if it is the union of the Jivatma and Paramatma, Yuj, through music it happens. Through dance it happens. That is what is the practical tool in Bhakti Yoga. If yoga is a Chittavritti Nirodha, it very much happens with the music and dance. So it is again yoga. Manav Prashamana Upayaha. the technique to calm down the mind. Yesterday we were in, I forgot her name, the ma'am with the singing bowl, the magical bowl. Vibhasha. So more, the moment we all went into, I think we all went into trance, and then the sound from me was competing with her sound even, of course. But then the tranquilizing effect, the mana prashamana, the calming down in the mind which happens, right? Our emotions, all the tug of war, the Mahabharata, I said, everything gets pacified immediately. And then the clarity, the inner clarity which dawns, which comes through music, dance and all those, which are all the wonderful tools of bhakti. So bhakti can be a wonderful tool in managing the manomaya kosha, the emotions. Thank you all.
Thank you so much, Subbu Bhaiya. Beautiful explanation. And the me in me loves the me in you, who has given us about this meanness. I would like to request Sobana ma'am to share some light, because she is both a professor of physiology and also is into music therapy. How the physiology and the music therapy come together in wellness from your point of view, ma'am?
Yes, sir. Thank you. So before I start that, I would like to add small, in a lighter moment, to what Dr. Rama Reddy had said. I was reminded of my time as an intern in the government medical college. He was telling, we'll write the symptoms, patient's name and the diagnosis, okay? And more than 40% are functional diseases. So what we do for many patients, we used to write KKK syndrome. Do you know that, sir? Have you heard of it? So because we don't know what it is, and the patient say, my leg is paining, hand is paining, we couldn't come to a diagnosis. We write it as Kai Kal Kodachar syndrome. Yes, sir. So, and to be more refined, because I can't repeating always no KKK, so I used to write GOK syndrome. Anybody could say what it is?
God alone knows.
God only knows. So it's true that many of the diseases don't actually have the anatomical or structural component of it. That means most of the disorders, maybe around 50% or more, are functional. Functional is because of your mind. Okay? An organic is, there is a pathology, there is change from the cellular level which adds up to end up in a disorder. Whereas when there is no pathology in the cellular level, the reason is your mind. There is another term for the mind-body medicine which our Professor Shiva Prakash uses, is the brain-body medicine. Okay. So when we say 50% of the disorders are functional, it is basically the problem with your brain or your mind which is the reason for the disorder. So where do you look now? You look at the origin of these disorders, or instead you look at how are you going to handle the situation. Okay? Doctors may handle if there is an abnormality or a pathology by means of medicine, surgery or whatever it is. Okay? What are we going to do for the other 50%? That is where all the other lifestyle practices come in. Yes? So we look at the major part of the disorders, or now we change our perspectives in looking at how do we establish well-being. Before the functional part sets in to establish or manifest as a functional disorder, you establish well-being in an individual so that you don't allow the functional disorder to set in at all. So are we just looking at the salutogenesis part now? Yes or no? Yes. So how do you set in well-being? When your rhythms, when the pituitary, yes, hypothalamo, pituitary, adrenal rhythms. The hypothalamus is the head of the entire organs, endocrine organs of our body. It is the major gland, and hypothalamus is under our emotional control. Okay, it is under the prefrontal lobe. So whatever you think or whatever you are put forth, your way of living, everything has an impact on your hypothalamus. So it gives a signal to your pituitary to all the organs in your body. Okay, so before I enter here, I am really stressed. What am I going to do? What Ananda sir is going to ask me? Okay, if he asks this, do I know the answer? Now what happened? Impulses from my prefrontal cortex goes to the hypothalamus and to the pituitary. So it says, Sobana, you are under stress. So my adrenaline increases. So what happens? My heartbeat is more. So I am little disturbed. I cannot answer properly. But if I know this is a calm environment, I can be myself, I can answer, then my prefrontal cortex knows, my hypothalamus, pituitary knows, and I am calm. Now it is the parasympathetic system which is acting, and if I am calm, I am able to be myself and I am able to answer. Okay, where is music in this? Okay, instead of coming, I came about a round route. Yes, where is music here? Music sets your body rhythms into the parasympathetic tone. Okay, it shifts from the sympathetic to parasympathetic. You are entrained towards parasympathetic. So when you are in, from a physiologist's point of view, when your body is in the parasympathetic tone, you are calm. Your heart rate is low. Your respiration is good, so that more oxygen flows to your brain and all your organs. Okay? Once your heart rate is low, the cardiac functioning or the output of the heart is good. Your hydrochloric acid from the stomach is less. There is no heartburn. Yes? And all your organs function in unity. In order to make that possible, music helps to bring your bodily rhythms into a tone, or it shifts to the parasympathetic tone. Now all our lifestyle modifications, maybe yoga or deep breathing practices, bhakti, spirituality and music, everything focuses on how we establish our parasympathetic tone. So from the physiologist's point of view, this is one line how I could bring in music and the parasympathetic tone, which helps us to balance. So how each type of music does, or how the different type of intervention does, has different answers. Maybe when you are receptive, yesterday how it happened during Vibha's session, is a receptive musical experience wherein you receive it and your rhythms in your brain are shifted from alpha to beta, beta to alpha and delta, which are deep sleep. Okay, so that is receptive. Recreating is, you may repeat something wherein you forget everything. I heard like distraction therapy from one of our participants. So recreating or mirroring is a distraction therapy wherein you are fully into that. You forget everything, you are fully into it. Other thing, improvisational also, you use your prefrontal cortex, you get diverted, you express yourself. When you have the chance of expressing, so when you pile up everything inside only, your anxiety increases. When you express, it is put out. So like that, where I am, different musical interventions or different type of music therapies have their own way of acting and establishing the parasympathetic tone or wellness in us.
Wonderful.
But the only answer is music, as other lifestyle modification, helps us to shift ourselves from the sympathetic to the parasympathetic tone, which helps us to focus on wellness and the salutogenesis.
Wonderful. Thank you so much, ma'am.
Thank you, sir.
Very beautiful depiction of how the internal functioning is creating that homeostatic balance. and how you move from illness to wellness and from pathogenesis to salutogenesis using the boat called music therapy. I was just thinking, we have Baishali ma'am, we have a lot of young music therapists out here, both physically young and also mentally and emotionally and, youthful. As a music therapist, what are some of the qualities you feel are essential when they go out to spread this message of music therapy for wellness?
Yes, of course. I think most of the qualities that they already have, I mean, in the process of training, so that is the first, I think one of the first classes that they have on the qualities of music therapist. So, I mean, generally to say, the first quality which is very important for a music therapist to have is the musical competency and the musical skills. Because the mode of communication in therapeutic session is exclusively music. Until and unless a client needs to be involved in a verbal discussion, or for some clients maybe to some extent counseling is required. Apart from that, it's always preferred and encouraged that you establish the connection with your client through the medium of sound. So that's the first quality. And apart from that, of course, some of the other qualities like today we had one presentation on empathy, compassion.
Yes.
So this is one of the primary skills. It's not only for music therapy, I feel, but for all therapists, it's one of the skills that we all need to actually, nurture within ourselves. That is, be empathic to the need of the client. I mean, understanding emotions, taking their perspective. Instead of, attributing my structure or my perception on the client, it's always to understand their emotions. And based on that empathic understanding, it is the music that is usually improvised, or as Dr. Sobana was giving the examples of the methods, or to decide whether to go for the receptive mode, or if it is improvisation, within improvisation there are several techniques. So which technique to go for? It's not that all clients will be quite okay in the process of recreation. So it's the empathy that guides the decision of a therapist to go for a particular music as well as the selection of technique. So apart from empathy and compassion, of course, the other qualities like patience, ability to listen to the problems of the clients, and also the behavioral part, communication skills. So all of these are very basic and the primary skills for a therapist to give music therapy.
Thank you so much, ma'am. That's a beautiful picture of what it is to be a music therapist, and I think many of those are required by all therapists, including the yoga therapists. And I think that is why we had that beautiful session on empathy. Because it's such a positive emotion when we talk about emotions.
And I really like the concept that they are talking about the courses, compassion training course.
Beautiful.
So where in 6 weeks program, they are training therapists to become compassionate. And as well as having the measures for their evaluation at each and every level when they are learning about being empathic or being compassionate. So maybe in future we can also think of such concepts to integrate in our training programs.
Absolutely.
Yeah.
Do we really need a course to learn compassion?
Well, now it shows how far away we humans have come from being human that we did it. I just wanted to go over to Devasena because it's the evening and we have heard a lot about bhakti. Maybe you could just lead us in a small bhajan, a very simple one that they could all join. So that they get a bit of that feel of what it is, otherwise it's becoming a bit heavy.
Just simply chanting Om Namah Shivaya as a favorite of Swamiji, Swami Githananda Giri. Of course, he was going often for everything almost Shiva, 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 because he born on the Vyasa Purnami, the special Purnami, Sage Vyasa's Jayanti. Again, his cycle was again the Margari. He just finished actually, so auspicious month. So his Samadhi again, the Arudra Darshan, the Rudra, the opposite for Rudra, Arudra. So happily Lord Shiva dancing. So Arudra Darshan, that was his again Samadhi. So
From that.
so yeah, quite often he was going Shiva, Shiva, Shiva. So simply we chant Shivam, goodness. So we chant the Om Namah Shivaya. Om Namah Shivaya, Om Namah Shivaya,
Om Namah Shivaya,
Om Namah Shivaya, Om Namah Shivaya, Om Namah Shivaya,
Om Namah Shivaya, Om Namah Shivaya.
Shiva, 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 Shivaya,
Shiva, 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 Shivaya.
Shiva, 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 Shivaya,
Shiva, 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 Shivaya.
Om Namah Shivaya, Om Namah Shivaya,
Om Namah Shivaya, Om Namah Shivaya.
Om Namah Shivaya, Om Namah Shivaya,
Om Namah Shivaya, Om Namah Shivaya.
Linga, 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 Shivaya,
Linga, 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 Shivaya.
Linga, 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 Shivaya,
Linga, 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 Shivaya.
Linga, 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 Shivaya,
Linga, 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 Shivaya.
Linga, 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 Shivaya,
Linga, 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 Shivaya.
Om Namah Shivaya, Om Namah Shivaya,
Om Namah Shivaya, Om Namah Shivaya.
Om Namah Shivaya, Om Namah Shivaya,
Om Namah Shivaya, Om Namah Shivaya.
Rudra, 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 Shivaya,
Rudra, 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 Shivaya.
Rudra, 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 Shivaya,
Rudra, 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 Shivaya.
Rudra, 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 Shivaya,
Rudra, 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 Shivaya.
Rudra, 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 Shivaya,
Rudra, 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 Shivaya.
Rudra, 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 Shivaya,
Rudra, 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 Shivaya.
Om Namah Shivaya, Om Namah Shivaya,
Om Namah Shivaya, Om Namah Shivaya.
Om Namah Shivaya, Om Namah Shivaya,
Om Namah Shivaya, Om Namah Shivaya.
Om Namah Shivaya, Om Namah Shivaya,
Om Namah Shivaya, Om Namah Shivaya.
Om Namah Shivaya,
Om Namah Shivaya.
Om Namah Shivaya,
Om Namah Shivaya.
Om Namah Shivaya,
Om Namah Shivaya.
Om Namah Shivaya.
Wonderful, wonderful. We got everybody singing there. That is really nice. As we are coming towards the end of the day, I thought we will go around our panelists and ask them, what does wellness mean to you in maybe 2 or 3 words? Not more than 2 or 3 words. What does wellness mean to you? When you hear the word wellness, what do you perceive? Can we have the mic here? We start with Pathak ji. He has been very busy since yesterday. So many times we have had interactions, but I want to get the best out of everyone. Yes, sir.
Wellness is definitely important from today's point of view. The WHO has already defined the health is good health is not just absence of disease, but health at the level of physical, mental, social, and now we are adding emotional also. So when at all 5 levels, if the health is there, then it can be called as a good health, and that will be only the wellness.
Wonderful,
Thank you, sir.
wonderful. Cathy, a couple of words. What is wellness for you?
I agree.
Yeah.
I agree, is what I said. But I'm just going to take a minute to say...
I just want to be sure it's on.
Was it on at the back?
Yeah, now it's on. Yeah.
I just wanted to say, from some of this morning's talks, when I had the chance, I stood up and looked to see if I could see my feet. Oh, thank God. Thank God I can see my feet. But I just want to say, after the couple of days we've talked a lot about illness and therapy and all the rest of it. Wellness to me, as a therapist maybe, or a yoga teacher or something anyway, that I need to learn to remain healthy myself, because I cannot impart good health to anyone if I'm failing in looking after myself. So first priority is caring for self.
Wonderful, wonderful. Yes, ma'am.
Yes. Of late I am feeling, or I am defining wellness as wherever I am and whatever I do, I should feel at ease physically and mentally.
Beautiful, beautiful.
Wellness to me is not to be in your own well, but to bring out the well in you for the welfare of others.
Wow.
In Sanskrit, it is called swastha. Swastha means in swa, in myself. But as my colleague has suggested, myself means I am part of the whole universe, and universe is myself for me. So I am connected with the whole universe through my personality.
Beautiful.
So you can say that when I am able to...
Meena, ma'am.
You are not listening. Very bad word.
No, sir. Meena, anga the chair.
This obedient boy. Actually, I remember Swamiji of Namah Shivaya. That wonderful, tasteful. And now I remember Swamiji, how he used to sing. The tone and everything was different. Wellness, when I'm able to enjoy my work, share with others, Nishkam Karma, and take joy in that, that's real wellness. And that's the spiritual point. This spirituality was raised many times. What is spirituality? What is spirituality? You can have many definitions. Even somebody's spiritual leader can be Osama bin Laden. He is also spiritual, for them leader. If you feel this, you go that one Paramatma, the Vedic concept, we are all his children, and he is all pervading. And then you see that divinity. I say Namaste. What do you do Namaste? I see divine in you. I both divine in you. Isn't it? That feeling. So it's been all common what he was saying. That was Nirakar Prabhu hai, sabhi mein samaya, sabhi phira apne koi na paraya. That is spirituality.
Wow.
That is spirituality.
Freedom from fear and sorrows, not only for me and all people around. Peace and contentment with whatever we have, we should be contented with that one. And empathy, which Madam was talking about, that is the key factor for everything in the world. Empathy should prevail among all the people around.
Beautiful.
Wellness to me, that when I find myself that I'm able to accept whatever is happening to me, I'm able to accept, and at the same time, life is meaningful to me.
Beautiful, beautiful.
So as we sing, we should not be going out of the Shruti. So Shruti is like a mother in the Sangeetam. And of course, Laya is like a father. So we should not be going out of the Swarasthana. So we should be in the Swarasthana when we are singing. So almost like that. Similarly, we have to be in our Sukhasthana. That was our Swast, our Sukham. Of course, for me, like as our Madanmohan ji said, like when Swamiji calling Shiva, Shiva, Ganapati, come. So we feel like he's really stimulating that energy, you know. When he's chanting Om Tat Ganeshaya Vidmahe Vakratundaya Dhimahi Tanno Dantihi Prachodayate Om. Of course, when my father goes, Om Shuklam Bharadaram Vishnum Shashivaratam Chaturpujam Prasannavadaram Dhyayat Sarva Vignobashantayet. That's what make me the Sukhasthanam. Not like people just laughing for anything. Just for, even when we are singing, they can laugh. Not like that. So when I hear that, I just automatically lifted my lokha, goes to that. So I'm feeling, sukham, I'm comfortable. And of course, whenever I'm singing or dancing, of course, make my sukhasthanam actually. So when we are going, like when Dax are singing, sorry.
So I wish to thank all our panelists for a very beautiful panel discussion where I hope that you got a lot out of it. And we come to the conclusion of today's full conference and the 2-day pre-conference plus conference events. We have a few prizes to give away and a few honors to be done. We'll do that now, and then we'll be shifting to the next room where we have organized the chairs and all for the group photo. So rather than trying to get everybody together, we'll shift there for an organized conference group photos. So we have at this time